Smoking is detrimental to health and it is life-threatening habit. Assalamu alaikum, how are you? I hope you all are well. Smoking damages the airways and small air sacs in your lungs. This damage starts soon after someone starts smoking, and lung function continues to worsen as long as the person smokes still. It may take years for the problem to become noticeable enough for lung disease to be diagnosed. Smoke damage in the lungs can lead to serious long-term lung diseases such as COPD, that means chronic obstructive pulmonary disease. Smoking can also increase the risk of lung infections such as pneumonia and tuberculosis, and it can worsen some existing lung diseases such as asthma. COPD, chronic obstructive pulmonary diseases, which is one of the leading causes of death in the United States, includes both chronic bronchitis and emphysema. Chronic obstructive pulmonary disorder, that means COPD, is one of the leading causes of death. It may cause death. In COPD, damage to the small airways in the lungs makes it hard for the lungs to get oxygen to the rest of the body. Smoking is by far the most common cause of COPD. The risk goes up the more you smoke and the longer you smoke. Some of the early signs and symptoms of COPD can include noises in the chest, such as wheezing, ratting, or whistling. Some of the early signs and symptoms of COPD can cause or include noises in the chest, such as wheezing, ratting, shortness of breath when active, and coughing up mucus. Over time, COPD can make it hard to breathe at rest, as well sometimes even when a person is getting oxygen through a mask or nasal tube. COPD tends to get worse over time, especially if a person continues to smoke. There is no cure for COPD, although some medicines might help with symptoms. Chronic bronchitis is a common problem in people who smoke for a long time. In this disease, the airways make too much mucus, forcing the person to try to cough it out. The airways become inflamed, that means swollen, and the cough becomes chronic, that means long-lasting. Chronic means long-lasting. The symptoms can get better at times, but the cough keeps coming back. Over time, the airways can get blocked by scar tissue and mucus, which can lead to emphysema. In emphysema, the walls between the tiny air sacs in the lungs break down, which creates larger but fewer sacs. This lowers the amount of oxygen reaching the blood. Over time, these sacs can break down to the point where a person with emphysema might struggle to get enough air, even when at rest. People with emphysema are at risk for many other problems linked to weak lung function, including pneumonia. In later stages of the disease, patients often need an oxygen mask or tube to help them breathe. Emphysema too cannot be cured, but it can be treated and slowed down if the person stops smoking. So, why do people who smoke have a smoker's cup? Tobacco smoke has many chemicals and particles that can irritate the upper airways and the lungs. When a person inhales these substances, the body tries to get rid of them by making mucus and causing a cough. The early morning cough common among people who smoke happens for many reasons. Normally, tiny hair-like structures called cilia in the airways help sweep harmful material out of the lungs, but tobacco smoke slows the sweeping action. So some of the mucus and particles in the smoke stay in the lungs and airways. While the person sleeps and doesn't smoke, some cilia recover and start working again. After waking up, the person coughs because the lungs are trying to clear away the irritants and mucus that build up from the day before. So-called smoker's cough can be an early sign of COPD. Last discussion about how smoking tobacco affects your heart and blood vessels. Smoking tobacco damages your heart and blood vessels, that means cardiovascular system, increasing your risk of heart disease and stroke. Smoking is a major cause of coronary heart disease, in short term CHD, in which the arteries of the heart can't supply the heart muscle with enough oxygen-rich blood. CHD is the main cause of heart attacks, and it's the leading cause of death in the United States. Smoking causes high blood pressure, lowers your ability to exercise, and makes your body more likely to clot. It also lowers HDL level, that means cholesterol levels in the blood. All of these are risk factors for heart attacks and strokes. Smoking is a major risk factor for peripheral arterial disease, in short form PAD. In PAD, plaque builds up in the arteries that carry blood to the head, organs and limbs. This increases your risk of heart disease, heart attack and finally stroke. Smoking increases the risk of having an aortic aneurysm. Smoking increases the risk of having an aortic aneurysm. This is a balloon-like bulk in the aorta, the main artery carrying blood from the heart to other organs. It is caused by weakening of the wall of the aorta. Aortic aneurysms can grow larger over time, and they can be life-threatening if they rupture, that means break open. Smoking can cause or worsen poor blood flow to the arms and legs, which is called peripheral vascular disease or PVD. This can lead to pain, in the legs when walking and may lead to open sores that don't heal. Because smoking affects blood flow, it can lower the body's ability to heal from cuts. This is why many doctors won't do certain operations on patients unless they stop smoking. So please avoid smoking habits and if possible please stop soon. Have a good day or good night for everyone who are watching this video. I hope you will be beneficial by the channel and please subscribe who haven't done it yet. Thank you very much. See you again with a good informative video. Hope you will be well.